Hey guys, so today we're going to be talking about Candida. And Candida is a yeast that you have commonly in your body, and it's part of your flora. And the thing is, when it gets out of control and it overgrows, and then that becomes a problem. So you can have it as a yeast infection in your vagina, which is the most common. You can have oral thrush, which would be an overgrowth in your mouth, and you can have Candida in your GI tract. But when it overgrows too much, that's when it becomes so dangerous. Besides the uncomfortable symptoms of having Candida, the thing is that it can migrate into so it's in the cavities, right? It would be in your vagina, in your GI tract, so your anus would have it as well, and your mouth, but then it can migrate internally and cause a whole lot of damage. So what are the signs and symptoms besides the itching that you already know? Exhaustion, cravings for carbohydrates and sugars, bad breath, eczema, vaginal itch, and anal itch could be a sign. White coating in your tongue, it could be thin or thick, brain fog, joint pain, low sex drive, chronic sinus issues, your immunity goes down, so you're catching colds all the time. In the GI, you will have gas and bloating. Skin and nail fungus could be an indication that you have Candida overgrowth in your body. Hormonal imbalances, because the byproduct that Candida metabolizes, one of the metabolites that Candida makes, it mimics estrogen in your body, so you have hormonal imbalances from that. So there are many causes for Candida, but the main causes are dysbiosis. So whenever you have an imbalance in your bacteria, good and bad guys are not balanced, well, Candida is one of the good guys, but it will overgrow. A high sugar diet, very common. This is the most common cause of Candida, is a very high carbohydrate or sugar diet, because it feeds on that. Very high stress, because it changes your microbiota, and it changes your pH and impairs your digestion, and so you get Candida overgrowth. The use of corticosteroids in your mouth, so if you have asthma, it's indicated that after you use your little pump, you swish your mouth with the water very well so that you don't have that there locally, because that would disrupt the flora in your mouth and make Candida grow. When you're taking antibiotics, it's very common, especially for women, to have vaginal infections. When you take broad spectrum antibiotics, because it's killing all the bad guys, but it's also killing all the good guys, and then it doesn't target yeast, and so the yeast are going to thrive, right? That's why it's good for when you are taking a broad spectrum antibiotic. During you're taking it, take something called Saccharomyces cerevisiae. It's a type of probiotic, which is a yeast, and so it kind of keeps Candida in check until you're done with your antibiotics, and then you want to recolonize with bacteria. It doesn't make sense for you to take probiotics of bacterial strains while you're taking antibiotics, because you're just killing and throwing your money away. That's another subject. Sorry, I went out on a tangent there. Also, birth control pills can cause Candida because of all the alterations that it does in your body. Probably because of alterations of pH in your vagina and hormonal imbalances. Also, cancer treatments and diabetes. Diabetes makes sense because you have a lot of sugar in your body with diabetes, because you're not absorbing all that sugar into the cells, so the Candida will thrive like that as well. And when you have a lowered immune system for any reason, HIV and other diseases that can compromise your immune system. So there are some tests that you can do. So there's a little simple one that you can spit in a glass of water, and you can Google this later. I won't go into detail here. You spit in a glass of water, kind of leave it there for a few hours, and then you can see if your spit forms strings going down in the water. It could be an indication that you have Candida, but that's not validated at all. It can be a good start for you to, if you have these symptoms and then you spit on the cup and you kind of see that could be a good indication. But there are real tests that you can do. So you can test for Candida antibodies in your blood, and you can take a PCR stool test and test for Candida in your stools if you have Candida. Or you can take a organic acid test and look for something called D-ribitol, because that is a byproduct of Candida. What are the treatments? That's the most important for us all. So we want to starve the fungus. We don't want to feed it. And what does it like? It likes sugar, right? And it also likes fermented things made of yeast. So yeast bread, Kombucha has yeast in it. It is a colony of both yeast and bacteria, so you don't want to have anything mold cheese, like things with molds, blue cheese and cheeses that have that mold coating around it. Definitely no peanuts because of the mold in that. And any moldy foods and foods that have yeast, especially even nutritional yeast, things that can be healthy for you, but during that period of treatment, you don't want to have anything that have a lot of yeast in it, or actually no yeast. You also don't want to have simple carbohydrates and sugars because you're just feeding it more and it gets stronger and stronger, right? You want to strengthen your immune system, and how do you do that? Well, you change your stress levels, you sleep better, you exercise, you have a healthy diet, and all that strengthens your immune system. Make sure that you have all your vitamins because that influences your immune system. And you want to make the good bacteria thrive again and grow again so that it can outcompete the Candida. So by having a diet that's full in prebiotics, which are the fibers, all those phytonutrients from fruits and vegetables, that will feed the good bacteria so that they will grow and outcompete the Candida. Definitely no alcohol because that feeds the bacteria as well. And lowering your stress is very important because high stress is a cause of Candida because it impairs your digestion. And then you can add some probiotics because then you adding some good bacteria, it will outcompete the yeast. And some fermented foods that are bacteria. So sauerkraut, not the ones that are fermented with yeast, right? The ones that are fermented with kimchi, sauerkraut, and pickles. You can have that. And there are some supplements that help to kill the fungus, which is berberine, caprylic acid, and lauric acid, and these are found in coconut oil. Actually, coconut oil is a very good strategy to swish in your mouth if you have oral thrush. You can apply in the vagina if you have yeast there around. I would not recommend putting it inside. And you can have tea, milked thistle tea, because it helps with the detoxing of your liver. Fungus is very toxic to the body, more than bacteria. So it really overloads your liver when you have a Candida infection. So you want to take care of that by taking care of your diet and then drinking a lot of water. And milk thistle tea helps with that. Spices that fight Candida are oregano, thyme, and clove. So these can be made into teas, and you can put it in your food, and you can use these essential oils around your house, diffusing them. Very careful with oregano tea on mucosal layers, so mouth and vagina and stuff. It burns, okay? You don't want to do that. Clove is also very burning. So there are protocols of treating this with topical, but you have to dilute it in a lot of oil before you put it on your skin, okay? Because these will burn. So you can swish around coconut oil with 1 drop of clove or oregano, swish it around your mouth and spit it out, and then rinse with warm water to remove that excess oil from your mouth. You can do it topically also, but also always diluted in the carrier oil. Cranberry juice, unsweetened cranberry juice, the one that comes in the glass bottle that is very expensive, that's the one. It really helps. Like in UTIs, it helps as well with yeast infections. And one reminder, when you are treating Candida, when you're starving it with your diet, when you're taking any of these supplements that kill it, when you're using the essential oils and the yeast begin to die, you have something called die-off syndrome, and you're gonna feel really bad. What can help is during that period, you take some activated charcoal because that will bind these toxins that the yeast are releasing, and it's making you feel awful. And then, of course, there are medications that you can take, diflucan and nystatin, but that's with the doctor. And I think I said everything. If you have any questions about Candida, I am here to help.